Good afternoon, everyone, and welcome to Dialogue with Dean Barker. My name is Kevin Feckety. I'm a third-year College of Pharmacy student here at Purdue, and I'm going to be your moderator this afternoon. Today we're going to be learning more about the BoilerWoRx program that the College of Pharmacy has recently started. Before we start, though, I just want to remind everyone watching, if you have any questions during the discussion that we're having today, feel free to comment. And then at the end, I'll go back to those questions and we'll kind of cover them and go through them as well. But other than that, we'll get started and I'll turn it over to Dean Eric Barker. Thank you.
Thanks, Kevin. Good to see you. Thanks for being here. Thanks for joining us again this month. We're excited, as we have been in this new series, to share exciting things that are going on in the College of Pharmacy. And we're really excited to be able to share what's going on with BoilerWoRx, which is our new community engagement project. It was started as a focus on responding to crisis, promoting safe and healthy communities, with the first focus being in the opioid crisis space. And it's great to have with us today Kathy Scott, who is our program manager for BoilerWoRx. I just want to share that BoilerWoRx was originally created through a very generous gift from the Cheney Family Foundation. Jeannie Cheney, one of our alums, her husband Jim, a dear friend of the college, very generously supported starting this project and have continued to support it. And it really gave us the catalyst that we needed to get this thing going. And so we're really excited about what's going on with BoilerWoRx. And Kathy, welcome to the college. Most of the time, Kathy's office is on the other side of campus, so we don't get to see you very often. She's in the Regan Street Center for Healthcare Engineering on the other side of campus. But Kathy, welcome up to this side of campus. And maybe you could tell us a little bit more about BoilerWoRx and what areas BoilerWoRx has been supporting in the past few months.
I'm happy to do that, Dean Barker. Thank you for the opportunity today to give everyone a little bit of an update. BoilerWoRx really has determined that the best way to approach the opioid crisis is with looking at 6 particular areas or segments so that we can be more effective in trying to bring our message and to impact the issue. We are focusing on naloxone training and distribution in partnership with the Tippecanoe County Health Department. We also are providing educational interventions as it relates to drug destruction, and it is critically important to get those unused, leftover, extra medications out of the home. Right. And we have a mechanism by which we can do that, and we provide education and what we call deter bags. It's a mechanism by which we can hand these out to the public, take them home, go through your medicine cabinet, dispose of those drugs in these bags, add some water, mix up a slurry of sorts, and it truly deactivates all of these active compounds. It's biodegradable and it can be just tossed away. So getting those drugs out of the home is the point of that message. We do a lot in the area of wellness education that focuses on the fact that addiction is a mental illness. And it is important that this message be consistently conveyed and it become a topic of discussion among many different environments. In addition to that, we really advocate for mental health first aid. We want to make sure that the general population, general citizenry, has an increased exposure to first aid that can be rendered to someone in terms of mental health illness. We provide subject matter expertise in the area of public policy and advocacy. We are able to leverage a lot of phenomenal resources in not only the college but in the university towards that effort. And in addition, we also address the issue of stigmatizing language. Words matter. They matter a lot. And we need to make sure that the vocabulary that is a part of our discussions with the opioid crisis and the subject of addictions have an appropriate conversation. And last but certainly not least, harm reduction is a significant area of focus. It's a public health principle. You are trying to anticipate what might be harmful and to mitigate it. Bicycle helmets, sunscreen, seat belts. Well, in our particular case, we are having significant discussions around safe syringe services programs, removing those dirty needles from the community, talking about ways to start conversation with people struggling with addiction that is more likely to lead to treatment, and not only lead to treatment, but lead to continued participation in treatment. So those particular areas of focus have enabled us to become more effective, we think, and more efficient in tailoring our message for communities in need.
Great. You mentioned the Tippecanoe County Health Board and the work we're doing with them. Is BoilerWoRx only working in Tippecanoe County, or are we spreading out?
We're spreading out. We are spreading our wings, and we are fortunate to be able to do so. We are involved in some projects that are taking us to our adjacent communities and counties in and around Tippecanoe County. And in addition to that, we are working with the area health education centers in north central Indiana and covering their county area also with programming. But a very important point, and it has to do really with how fortunate we are at Purdue University to have an extraordinary extension service. And through the extension service at Purdue, and actually and through Purdue's extension service relationship with the Department of Agriculture's Office for Rural Health Initiatives, we have been able to partner with and through them with various counties around the state. It's an important step, and it's an important partnership in terms of our outreach for the common good of various counties.
I appreciate the effort that you all are making to work with Purdue Extension. We really have that unique opportunity here at Purdue. We have such a robust extension network, and really that gives us the opportunity for doing community engagement, which is exactly what we had hoped to do, to be able to go out and make a difference. Tell me a little bit about how our students are being involved in BoilerWoRx.
We are tremendously fortunate to have great student involvement, not only in the College of Pharmacy, which has been crucial in getting things off the ground, but also in combination with engineering students, with nursing students, with health and human services students. There is an organization on campus, it's called IHI Purdue. It's a student organization. It's about improvement in healthcare, and that organization has multiple different disciplines around campus that are involved, and IHI was also instrumental in some of our initial work in getting BoilerWoRx off the ground. They are a terrific force multiplier for us. They are all educated and trained to provide vaccinations when we go out and do county outreach programs. We had a program with Lafayette Transitional Housing where we were able to provide vaccinations as well as educational intervention and support, and our students enable us to do that in large and effective numbers. It is important to us that our student volunteerism has a baseline knowledge level, skill level. They all complete a checkoff, skills and knowledge checkoff, and that way we know what the basis level of understanding, knowledge, and skill that our student volunteers bring to us, and we're very confident when we go out and take students to our various events around the state.
Well, I'm real happy to see all the things you're doing. You're very, very busy. Lots of things going on, but briefly tell us some of the events that you've got lined up for the next couple months.
Our next few months are really busy. That's a good thing. We like that challenge. We have 8 events that are part of our partnership and a grant we have with Tippecanoe County Health Department, and we have developed educational interventions with this group, and we are reaching out to not only community lay members but also community health workers of all sorts. We have a grant in partnership with AHEC, the Area Health Education Centers, and in that particular case we have developed educational interventions that are actually providing CE for those health workers, licensed health professionals that may be attending. For pharmacists, there are 2 hours of required CE now in the area of the opioid crisis and epidemic, and that particular programming in those 12 counties, it will qualify to satisfy that particular requirement. And we feel like those particular partnerships have been extraordinarily meaningful for us. And across those 20 events that are already scheduled, we have continuing requests from counties around the state to come and do developmental programming with them. One of our primary underpinning philosophies is that we don't know what's best for everybody. We want to work with counties, the county stakeholders. They know their counties, they know their issues. We feel strongly that we can bring some subject matter expertise to combine with that tailored county knowledge and provide tailored programming that could have the best potential for impact.
That's great. So how do you see BoilerWoRx expanding in the future?
I think that it can be limitless. At this point in time, we still have a challenge in front of us that's important, and I think that part of what we will do to increase our footprint, so to speak, is also through the research avenue. There are community hospitals that now are people with addictions are being admitted for medical issues, but community health workers and the community hospital professionals are not necessarily well prepared to deal with the addiction side of it. We find that community pharmacists are reaching out because they are coming face to face with issues related to the opioid epidemic, but they feel like they need more in terms of some training and some opportunity to learn more about how to interface with that walk-in patient population they deal with. And we feel like we can bring some research expertise to help them look at, study, and evaluate those issues in a structured, purposeful way. I'd like to take a minute to mention the fact that the BoilerWoRx leadership team is not only me. Dr. Carol Ott, who is our faculty leadership team member, she's a clinical pharmacy professor, and she is board certified in psychiatric pharmacy. And Dr. Nicole Noel, which is our Purdue Pharmacy director, has a vast knowledge and experience in community pharmacies. So we bring lots of different areas of expertise to the leadership table. And I think through that we have lots of other outreach potential.
It was pretty clear to me when we started the conversations around BoilerWoRx well over a year ago that there was a need. I mean, pharmacy is at the center. Mm-hmm. We know community pharmacies particularly are at the center of the opioid crisis, but that's a multidisciplinary issue, and that's the beauty of what we're partnering here on our campus with our extension offices, with Regan Street Center for Healthcare Engineering, School of Nursing, Engineering. Really, we're just a piece of the overall Purdue effort, but we know pharmacy plays an important role. Maybe you've got some questions for me from your perspective.
Well, I think probably looking forward, one of the things that is of interest to us and hopefully to those participating today is how you might see BoilerWoRx evolving going forward in the future in addition to the opioid epidemic.
There's no question that when one public health crisis goes away, there's always seems like there's one behind it. We were very deliberate when we named BoilerWoRx to not embed opioids in the title, and that the heading of responding to crisis, promoting safe and healthy communities really is what we want BoilerWoRx to be about. And so whatever comes next, we will be ready, and the experience of our faculty, our staff, and our students is broad. Right now we're in the opioid space. There'll be other things that will come behind, whatever that is, whether it's an issue around infectious disease, whether it's an issue around community health, or other substance use disorder. I think we'll be ready to respond and be a part of a solution for the state of Indiana and beyond.
We're so fortunate to have so many different types of resources, for sure. In addition to what we have been able to jumpstart, so to speak, through the Cheney Family Foundation, there may be other ways that people are interested in being able to participate or provide support to our BoilerWoRx initiative, and maybe you can tell us a little more about that.
Yeah, so we're real excited about the potential for others to be involved. Lots of things folks can do. First, we'd encourage you to go to the BoilerWoRx website, pharmacy.purdue.edu/BoilerWoRx, WORX for works, but pharmacy.purdue.edu, BoilerWoRx/BoilerWoRx. And there's information there about the program. There's contact information for Kathy, and you can find out how to reach out to Kathy. Maybe in your communities you have a need, and you might want someone from BoilerWoRx to be involved. We are designed to go out and reach out into the communities and be mobile. There may be an opportunity for some of our alums who are community pharmacists who have questions or have needs, or they want to be involved in their communities. They could reach out to you, and we can tap into that vast network of our alumni to be extensions of what we're doing here. Beyond that, certainly providing financial support as the Cheney Family Foundation did initially. If you go to the Giving tab on the Pharmacy College website and choose, you can choose Other and just put BoilerWoRx in the space there and make a gift that would support the effort that we're doing to make a difference in our communities. And lastly, to think about some other ways to give. You mentioned the doTERRA bags. As a way to dispose unused medication. Mallinckrodt, the pharmaceutical company Mallinckrodt, was very generous in providing those bags, 20,000 bags to us for distribution. And so it's a resource that's really important that allows us to make an impact in the communities and get the message out. And so maybe with various employers or other individuals, they may have other ways and items that they might think could be useful to us, and that could be very helpful. Reach out to Kathy and find out if there's ways to participate, and we'd love to see a variety of ways that individuals can give back. And so I think you people can just check out the website and get in touch with us and find out what's going on. So.
Yes, and we would appreciate that.
Okay. Thank you, everyone, for watching today. There were no questions posted, but after the video is posted, feel free to comment any questions you might have or comments on the program. And also, if you have any topic ideas you'd like to see Dean Barker discuss later, feel free to comment that as well. We want to thank Dean Barker and Kathy Scott both for being here today and talking about the BoilerWoRx initiative. We're really excited to see where it goes. It's already had a pretty successful impact in our local community here, and we're really excited to see it expand and move forward. So thank you all for watching, and Boiler up.
Boiler up.
Thank you.